Hello, I'm Dr. Giavonne Rondo, a local internal medicine physician, host of Healthy Mind, Body, and Spirit today, and we're doing a little bit something different. We have a guest, a wonderful guest that we're going to talk to a little bit later. We're going into the operating room. We're here in the lobby of a wonderful facility here, and we're going into one of the scariest places that you can possibly go into. The operating room, yes. But our wonderful guests are going to show us why we should not fear the operating room, why it is actually a place of healing, and we're going to just dispel some myths. We're going to dispel some fears and phobias about the operating room. So let's go. And we have our wonderful guest today who's going to introduce herself and go right ahead.
I'm Candice Atkins, originally from Indianapolis, Indiana, and attended Florida A&M University, and then returned back home to Indiana for medical school at IU. After medical school, I completed a 4-year residency in anesthesiology, and then a 1-year residency at Duke University in critical care. After that, in 2013, I moved here to Louisville to take care of critical care, critically ill patients after major heart and lung surgery. I also do general anesthesia, and that's what we'll be talking about today.
And as you can see, today we are in a whole new arena around here. And we have a wonderful guest that's going to show us about this whole new arena called the operating room. And I know a lot of us have trepidation and fears about the operating room, what goes on, a lot of phobias about surgeries or whatnot. So today, what we're going to do is try to dispel those fears, those phobias, and really focus on trying to be at our healthiest in and outside of the operating room. Talking about what's important when it comes to issues that go on in the operating room, just getting a better idea of all the things that go on and people that help us, like our guest today. So just tell us exactly, like in this arena, what exactly do you do here?
So as a general anesthesiologist, I work with patients and surgeons to create ideal operating conditions. What that means is I want the patient to be safe, I want the patient to be comfortable, but I also want the surgeon to have a good environment to operate in. If that means making sure that the patients are still, making sure that the patients are well relaxed and pain-free, that's what I'm going to do for the patient. I am a specialist in airways and monitoring, so occasionally that means that I have to take over and do the breathing for patients, and we use this machine here, a ventilator, to do that. And throughout the procedure, the biggest thing is to keep patients safe. So as you can see, I have lots and lots of monitors that I'll use to do that. I want to make sure that you're breathing okay, your heart rate and rhythm are okay, your oxygen level is just right, your blood pressure is just right, and that your lungs are working the way they're supposed to. So mostly I monitor you, I would control your breathing if need be, and just keeping you safe and comfortable throughout your surgical procedure.
Wow, we really need you, that you're an essential part of the patient's experience here. So safety, well-being, while you're actually having the operation, whatever operation is going on. So it sounds like you're just absolutely essential. So thank you. Thank you for what you do, and thank you for explaining that. So how has, this is a really different environment, but how has COVID-19 affected what you do here in the operating room as an anesthesiologist?
So initially, COVID, since it mostly affects the respiratory tract, and we are in close proximity to patients' respiratory tracts, being in their noses, mouths, pretty regularly, putting breathing tubes in and things like that, then we are at high risk for patients who have potentially been exposed. So we wear special equipment when we are close to a patient's airway to protect ourselves. and we try to protect the airway as quickly as possible to limit exposure to other staff members. One of the things that's been most beneficial is getting patients tested for COVID before they have an operation. If we know that a patient is negative, then there's less that goes into preparing for that operation. If we have a patient that's positive or we aren't sure their status, then there's a lot of modifications that have to be done to the plan, including to what equipment is kept in the room and what staff members are allowed in the room. So knowing that a patient is negative before they have surgery has been the biggest helper to limiting modifications that need to be done before an operation takes place.
Okay, so it sounds like you all have made a few changes with the whole regimen. Now, for surgeries and for the anesthesia. So, in terms of the mask, I see that we're wearing our masks and we're trying to stay 6 feet apart, for safety. But you all are the ones who really need what's called the highest level of protection, really, and you all wear the N95 mask.
Yes.
Okay.
So that mask has a filter in it that is capable of blocking very small particles like viruses. So since we are in close proximity to a patient's nose and mouth, as we put in breathing tubes, take out breathing tubes, there's high probability that patients may cough on us or expel their secretions into the air. And so we do our best to protect ourselves by wearing a specialized mask as well as face shields.
Okay. So that's very important. So your safety is important as well as obviously the patient safety too. So
yes,
absolutely. All right. So our show, Dr. Atkins, with Healthy Mind, Body, and Spirit, it's really focused on making sure that we put priority to the lives and the wellness for our whole world, but particularly with the African American community here in the Kentucky area. So, are there things that, as a community overall, that we should be doing for safety prior to having surgeries? What kinds of things should we focus on? Generally, as just an overall society, but particularly as an African American community.
So one of the things that I've noticed is that as a community, African Americans are generally less participatory in their care, like less proactive in their care. A lot of times we kind of sit back and we nod at the physicians and folks taking care of us, like, okay, I hear you, okay, and then we may go home and do something totally different besides the plan.
Yeah.
I would say that the biggest thing you can do before surgery is to just make sure that you are in good shape to have that procedure done.
Okay.
Making sure that your other diseases, or what we call comorbidities, are well controlled. That means that if you're diabetic, your blood sugar is well controlled. If you have high blood pressure, that you've been taking your medications appropriately and your blood pressure is well controlled. If you're a smoker, the single best thing you can do is to stop smoking, especially before surgery. Your lungs are very important. The lung function is very important in the operating room, and cigarettes really hinder and make it difficult for you to clear secretions. That's really important in the operating room. So stopping smoking, controlling your other diseases that you have before the surgery. Those are the biggest things. And don't eat.
Don't eat before surgery.
Don't eat before surgery.
Y'all heard it. Y'all heard it from the anesthesiologist. Do not eat before surgery. Control your diabetes, your blood pressure. Don't smoke. As a matter of fact, with that whole smoking issue, wouldn't that, especially in this COVID-19 era, make things worse, potentially?
Since COVID does put your lungs at risk more than most other body systems, being a smoker definitely makes you higher risk for having worse outcomes with COVID.
And we don't need that. We have enough issues.
Exactly.
So, and then you also mentioned not eating before surgery. So why is that so important? Why should people not eat? And I think there's even a thought too, you shouldn't have anything to drink. So tell us why.
So scientists who have studied patients having surgery and patients in general, we know that After you eat, it takes a certain amount of time for your food to leave the stomach. Depending on your other conditions like diabetes or being obese or overweight, that food may move slower outside of the stomach. Once your food is past the stomach, it's generally safe for the most part, but if it's in the stomach, the chance that it could come back up or regurgitate or vomit, that chance is higher under general anesthesia than it would be for a regular person. So we really want to make sure the stomach is empty. The safest thing is to not eat for several hours before your surgery. If you need to take a sip of water or a sip of a clear liquid to take your medications, that's perfectly fine. But if you need to have something on your stomach, it needs to be well before you get ready for your operation, at least 4 hours.
Absolutely. So that makes sense. It does make sense. So that just make sure that you all can do what you're come to do to make sure that patients are safe and make sure that their body functioning is as optimal as possible during the operation. So great. So this is a view of an operating room without obviously any operations going on. So this is just basically what an empty operating or OR room looks like. And we have again our special guest.
Hello.
Dr. Candice Atkins, who is a specialist here in the operating room. This is her home, this is her place again. And so we have a few more questions for Dr. Atkins in terms of anesthesia.
Sure.
And in terms of what goes on here in the operating room. So you utilize different types of medications that help people you were talking about being safe and relaxing. Could you kind of explain that a little bit more?
Sure. So depending on what type of procedure is happening and exactly what the surgeon needs, and depending on the patient's status going into surgery, we select the type of mixture that's going to be needed to keep the patient safe and comfortable. Sometimes that includes medications through an IV to help keep you asleep or help take care of pain, or to keep you perfectly still so the surgeon has the best conditions while operating. Sometimes that includes medications that you breathe through a breathing tube to help keep you asleep and unaware of what's going on. So it just depends on the type of surgery, what the surgeon needs, and the condition of the patient going into the operating room. That'll determine what combination of 6 to 10 medications we might use during a procedure.
Now, you mentioned different medications. Now, there's one medication that a lot of people have questions about, and they call it the Michael Jackson medicine, also called, we know of it as Propofol.
Yes.
Can you talk about that a little bit?
Sure. So Propofol is an IV anesthetic medicine. That means that given through an IV, it produces anesthesia or unawareness. It puts patients to sleep. It should only be used in the hands of people who have trained to use it, and it should only be used when a patient is going to be monitored for a procedure or as a sedative in the ICU. It should not be ingested. It should not be injected just under the skin. It should not be taken any other way except while being monitored for a procedure or in the ICU for the purpose of keeping someone asleep. The side effects include, dropping your blood pressure or making a patient stop breathing. So that's the reason you need to be highly monitored, and it needs to be given only by people who are professionals that are already certified to monitor patients. So he unfortunately made it famous for the wrong reasons. It's a very safe medication when used properly and by trained staff.
Great. Thank you for that information, Dr. Atkins. Now, you know so much about anesthesia, about the operating room. Just tell us a little bit about, just
in terms of what you enjoy the most about your job?
So one of my favorite things is actually creating a connection with patients. Like you mentioned earlier, patients are usually scared, they're nervous, they're afraid of surgery and anesthesia and just the unknown about what's going to happen to them while they're asleep. And so I try to come in bright, smiley, and create a rapport, create a relationship with the patient and patient family members before surgery so that they know they can trust me with their care while they're asleep. I'm going to do my very best to take excellent care of every patient that comes in the door, and I am highly trained and qualified to do the job. And so, I just want patients to relax. So that's one of the best things, one of the funnest things, most rewarding about being an anesthesiologist.
Well, I can tell you what, I feel more relaxed. Thank you, Dr. Adkins.
Sure.
Now, we have a segment of our show where we've had a discussion. We've discussed about anesthesia, about the operating room, about anesthesiologists just overall. And so, we've talked about it, but we also like to be about it. So we talk about health and wellness, but we also want to be about it. So tell us how you don't just talk about being healthy. How are you being healthy in and of itself?
Sure. Well, I don't smoke. I don't use drugs. And I try to eat healthy, stay a good size, exercise when I can, which in this job is not all that often, but I do the best that I can. I chase around a 2-year-old all the time. So that keeps me in pretty good shape. I try to control the things that I can control, like we talked about. If there's an underlying condition, I try to control that as best as possible. I've been lucky and healthy so far, so I don't have too much to control, but I just control the things that I can control. Before I go to have a procedure, I make a list of exactly what medications I take, what surgeries I've had in the past, and what medical problems I have. And that information is extremely critical to the people taking care of you. So I give that list to either the intake nurse or the anesthesiologist that's going to take care of me. It really helps them to put things in perspective and get a good idea of who I am as a patient. So that's how I would go into surgery.
Awesome.
With an empty stomach.
Yes. Thank you. Thank you for that clarification, because we want to make sure that we want to be as healthy as we possibly can. So we're taking it right from the lips of an anesthesiologist, what she does, and she makes sure that she has an empty stomach going into the operating room.
That's right.
Hey, Dr. Atkins, can you explain to us where we are, what we're seeing,
So this is the view of the anesthesiologist in the operating room. For the most part, we're focused on the patient, who is on a table here, and our monitors that help us keep the patient safe. So here with this monitor, I can track heart rate, heart rhythm, patient's blood pressure, their oxygen level, and how asleep they are, what their temperature is. This monitor here tells me all about the patient's lung function. I can control how fast or slow the patient breathes, how deep a breath they get in, and even let the patients breathe on their own if need be, while monitoring how effective those breaths are. If I need to give a patient medication through the breathing machine to keep them asleep, that medication would go in this slot here. And then this just provides for additional monitoring if that is a need. So, lots of options here, lots of things that are all dedicated to keeping you safe as a patient.
We have been on a journey throughout the operating room with Dr. Candice Adkins, and right now we are in the recovery room. So this is pretty much where after your operation, you actually will come, or someone will come after their operation. So Dr. Adkins, could you kind of explain the process of this recovery room?
Sure. So at the end of anesthesia, hopefully everything has gone well and patients are starting to wake up a little bit, and they need a place to wake up more and kind of get back to themselves. And so they'll come to this recovery room. They'll have one nurse assigned to help the process go smoothly, and the anesthesia team will come by and check in and make sure that things are progressing as they should. And then once you are kind of back to your normal self again, we'll sign you out and say that you're well enough to go to the next place, whether that is staying in the hospital while your surgical team watches over the procedure that you had, or if you're well enough to go home, then that would be from this place. So hopefully everything has gone well. We just check over things, make sure your vitals are stable and that your pain is well controlled and you're not nauseated. That's one of the more common things after receiving an anesthetic. So once we have those things under control, then you're free to go from here, wherever your next destination is.
Great. So what kinds of problems or complications are you looking for in the recovery room, in the recovery process?
So the most common thing that patients complain of is having a sore throat. That's usually from the equipment that we have to use or from the breathing tube that is put in during the procedure. So that's the most common thing we see. The thing that that would keep a patient in the recovery room that we would watch would be pain that's not controlled and nausea that's not controlled. So it's pretty common for patients to have nausea after receiving an anesthetic. And we give medications or IV fluids or things like that to help build up a patient's system, reserves. That's a good word, so that they're not nauseated. They can start to take medication or even food in the recovery room.
Okay.
Pain is also a big reason why somebody would stay in the recovery room. Of course, if you've had an incision, then we want to do everything we can to make sure that pain is well controlled. We want you to be awake enough that you can complain about the pain, but have it
Not
be
feel it as much,
tolerable.
yeah.
Right. As long as it's tolerable so that you can still communicate and breathe effectively, that's right where we want you to be. So the pain usually won't be zero, but it should be tolerable enough so that you can do your coughing and deep breathing and the things you need to do to recover.
Awesome. And so one of the biggest side effects from not only being a patient from before, but also being a physician is the nausea that you mentioned. Yeah. Where's that nausea coming from? Is it the medications?
So a lot of times it is the medications. If you are receiving an anesthetic where you get gases that you would inhale through a breathing circuit, those medications do cause nausea. Another thing is just being dehydrated. If you've ever been dehydrated before, your stomach isn't quite itself. So you lose fluid in the operating room. You've usually and hopefully not eaten right before surgery.
Right. That's what I was going to say. She does not want us to eat. You cannot eat.
That's right. So your patients are usually a little bit on the dehydrated side, and so a lot of times IV fluids will help that nausea go away.
Okay.
And we use medications also.
Well, thank you for explaining that. That's that helps me too, even as a physician. I'm not in the operating room as often, obviously, as Dr. Atkins. So thanks for explaining that. So you have really given us a lot of just great information, and we just kind of want to wrap things up. But what we want to talk about is if you have any things that you find are more difficult with your job as an anesthesiologist, things that maybe aren't as pleasurable, just talk about what you do.
So I love being in the operating room. I love taking care of patients that are undergoing surgery and helping to treat pain and anxiety, relieve fears, and just making sure people get through the system safely. One of the things that's a little more nuanced is probably developing that relationship with a patient or patient family initially, just getting through the things that we need to get through before you get to the operating room in a timely manner, and making a patient feel comfortable and like they're going to be well taken care of and that they're safe. That's one of the more nuanced things. It's not necessarily a difficult part. It's just a part that takes some art and some...
I like the way you put that. Nuanced. Yes.
Definitely. So that's one thing. The other thing is just figuring out that right combination of medications for each patient. Everybody's an individual. Everybody's body is a little bit differently. And kind of titrating or giving those medicines right at the right dose at the right time so that everything works out carefully. That's probably the most complicated part of the job. Not that it's necessarily difficult, it's just the more complex part of the job. So it's fun though. It's fun getting that combination just right.
And it sounds like you're the person for it.
That's
so
right.
Thank you. So what do you enjoy doing outside of the operating room? Tell us about that.
So I actually have another job inside of the hospital, but outside of the operating room, and caring for patients after major heart and lung surgery. And that is just working with the surgeon who's taking care of the patient or operated on the patient, as well as the other members of the medical team, to try to make sure that everything is well taken care of so that you recover at the best of our ability. So after an open heart surgery, I want to make sure that, again, that your pain is well controlled, that your symptoms, whatever brought you into the hospital, have either gone away or gotten much better so that you can move through the system safely. Some of those procedures are very high risk, and we need to watch you and monitor you very closely for even 2 or 3 days before we can let you move along through the system. And the ICU is the place for that, where we can monitor patients very closely. So that's another part of my job here at the hospital. Outside of the hospital, I am a wife and mother, and that's probably the best job I've ever had. My family is very important to me, so I spend as much time with them as possible.
Absolutely. Well, thank you, Dr. Atkins.
Thank
this
you
has
for
been
coming.
absolutely wonderful for educating us about what goes on before surgery, or what should go on before surgery, what happens actually in the operating room, particularly when it comes to anesthesia and anesthesiologist, and then, some of the preparation that you partake in to get ready for surgeries for you as an anesthesiologist. But like I said, also what happens during the surgeries, and then in the recovery process. And that it looks like you also play a role, not just in the recovery room, but also outside of these walls, in the intensive care unit, when people continue to need more services. And so it sounds like you are the wonderful woman, wonderful physician for this job. And we thank you for educating us. And I would love to have you come on again, just talking about, because Dr. Atkins has lots of other interests, even though she didn't mention it, she has lots of other interests. And so very big advocate when it comes to patients and patient safety, patient advocacy, education, just overall. So we'd love for you to come back and talk with us again on healthy mind, body, and spirit. Thank you.